Treatment of shoulder B syndrome and medulla oblongata pseudoplegia. Shoulder B syndrome mainly manifests as shoulder pain and limited movement in the shoulder area. Bulbar paralysis is caused by various disorders. It mainly manifests as difficulty in swallowing, hoarseness, and gastric reflux. Treatment of these disorders with acupuncture produces definite alleviation of the symptoms. Shoulder B syndrome. Shoulder B syndrome commonly happens to people after middle age. More females than males are afflicted with this syndrome. It is also called 落肩风、肩凝症、五十肩 and 老年间 respectively, according to differences in etiology, symptoms, and the age group the patient belongs to. In modern medical terms, it could be tenosytis of biceps brachii, periarthritis of the shoulder, bursitis, or tendinitis of the supraspinatus muscle. This disease is often caused by overwork, tendon or muscle injuries, exposure to wind and cold attack, or obstruction of jingluo due to damp evil. It can also be due to external trauma, which injures the jingluo in the shoulder area and blocks the circulation of qi and blood. In the early stage of the disease, shoulder pain and limited movement often appear on one side of the shoulders. For both shoulders to be afflicted at the same time is rarely seen. The pain can affect the neck and extend towards the shoulder, or in some cases, it manifests as general pain extending over the whole shoulder area. This disease is characterized by stationary pain, worse during the night, and alleviated in the morning after some deliberate movements or exercise of the shoulder. The pain affects such movements as lifting, abduction, adduction, and posterior extension. In the early stage, it is mainly manifested as pain, whereas in later stages, it mainly manifests as shoulder dysfunction. Patients feel extensive tenderness around the shoulder under pressing massage. Here we introduce 3 treatment protocols. They are Hogu puncturing method on selected points along the meridian combined with Asher points, local points, and distal points. Treatment according to selection of points along meridian accompanied with Hogu acupuncture method on Asher points. An Asher point is a tender point. It can be one or several points. Hogu puncturing method is to insert the needle into an Asher point first and lift the needle to just under the skin when the qi arrives. Then insert the needle towards the left, right, back, and forward, and when the qi arrives, lift and pluck the needle, followed by withdrawing the needle. Don't leave the needle in. Select a number 28 1.5 Cun needle. Puncture the points along the meridian, leaving the needle in for a while after the arrival of qi. Meanwhile, have the patient gently move his shoulder in different directions. Then apply Hogu puncturing method on the Asher points. Do not leave the needle in. After removing the needles, have the patient move the shoulder again. Each treatment lasts about 30 minutes. Based on the relationship between the tender areas and the meridian pathways, the shoulder B syndrome is also divided into the following 8 types. Hand tie-in type. This manifests as pain at the anterior part of the shoulder. It radiates a pulling pain in the chepan area, or medial anterior border of the upper arm, and it can extend to the thumb. The shoulder movement is limited. Prescription: 雨剂、阿是穴。雨剂。To treat, puncture 雨剂 of the long meridian of hand tie-in. Apply Hogu puncturing method on Asher points. Have the patient move his shoulder after removing the needles. The type of hand, Yang Ming meridian. This manifests as pain on the superior part of the shoulder, which radiates a pulling pain to the lateral anterior border of the upper arm, elbow, or even index finger. Shoulder movements such as abduction and lifting are limited. Prescription: 合谷、阿是穴。To treat, puncture 中足 of the hand Shaoyang meridian. Puncture Usher points with the Hugu puncturing method. Have the patient move his shoulder after the treatment. The type of hand Shaoyang meridian. This manifests as pain behind the acromion, radiating a pulling pain in the elbow, back of the neck, and ear. Shoulder movements such as extension, abduction, and lifting are limited. Prescription 中儒20穴 To treat, puncture 中儒 of the hand Shaoyang meridian. Puncture Usher points with the Hugu puncturing method. Have the patient move his shoulder after the treatment. The type of hand Taiyang meridian. This manifests as pain in the scapular area, which radiates to the neck and back, as well as causing limited movements in shoulder adduction or anterior extension. Prescription 万骨20穴 To treat, puncture 腕骨 of the hand Taiyang meridian. Apply Hugu puncturing method on Usher points. Have the patient move his shoulder after the treatment. The type of hand, Shaoyin meridian. This manifests as axillary pain, which radiates to the medial side of the arm and causes limited ability to lift the shoulder. Prescription 少服阿是穴 To treat, puncture 校服 of the hand Shaoyin meridian. Apply Hogel puncturing method on Usher points. Have the patient move his shoulder after the treatment. Combined type of hand Taiyin and hand Yangming. This manifests as pain on the anterior and superior part of the shoulder, which extends along the pathway of the two meridians. Movements such as posterior extension, abduction, and lifting are limited. Prescription 雨季合谷阿是穴 To treat, puncture 雨季 of the hand Taiyin meridian. Hegu of the hand Yangming meridian. Apply the Hogel puncturing method on Usher points. Have the patient move his shoulder after the treatment. The yang meridians of the hand, mixed type of 3. This manifests as pain on the superior, posterior, and scapular area of the shoulder, which then extends to the posterior aspect of the upper arm. Movements such as shoulder extension, abduction, and lifting are limited. Prescription: 合谷、中竹、腕骨、阿是穴。To treat, puncture 合谷 of the hand Yangming meridian. Zhongzhu of the hand Shaoyang meridian. Wangu of the hand Taiyang meridian. Apply the Hogu puncturing method on Asher points. After, have the patient move his shoulder. The mixed type of hand Taiyan meridians and 3 yang meridians of hand. This manifests as pain at the superior, posterior part of the shoulder and the scapular area, which extends to Chepan, the medial anterior border of the upper arm and lateral side of the upper arm. Shoulder movements in all directions are limited. Prescription: 雨季、合谷、中竹、腕骨、阿是穴。To treat, puncture 玉脊。合谷。中竹。腕骨。Apply the Hogu puncturing method to Asher points. Have the patient move his shoulder after the treatment. Selection of local points. Another method to treat shoulder B syndrome is to select local points. Prescription: 煎鱼、煎疗、煎针。煎鱼, located between the acromion and greater tuberosity of the humerus. For treatment, select number 28, 2.5 to 3 Cun needles. Thread the needle from 煎鱼 through to 极拳. Jianliao, located posterior and inferior to the acromion. Puncture 2 Cun obliquely. Jianzhen, located 1 Cun above the posterior end of the axillary fold. Puncture 2 Cun perpendicularly. Leave the needles in for 30 minutes. Have the patient move his shoulder after the treatment. Selection of remote points. The third method of treating the shoulder B syndrome is to use distant points. Prescription: 调口、承山。Thread the needle from 调口 through to 承山. 调口 is 2 Cun below 上巨虚. 承山 is directly below the belly of gastrocnemius muscle at the end of the depression. For treatment, select 3.5 Cun needle. Thread from 调口 to 承山. Ask the patient to move his shoulder when the qi arrives. Leave the needles in for 30 minutes. Treatment with medulla oblongata. Bulbar paralysis is caused by various disorders. It mainly manifests as difficulty in swallowing. Modern medicine regards bulbar paralysis as caused by diseases of the nucleus of the corticospinal tract, the nucleus solitarius, the nucleus ambiguus, the dorsal nucleus of the vagus nerve, the nucleus of the hypoglossal nerve, and other related cranial nerves. It is divided into true bulbar paralysis and pseudobulbar paralysis. Clinical manifestations include hoarseness, difficulty in swallowing, and liquid reflux in the esophagus. For pseudobulbar paralysis, there is also a positive lip tapping reflex, a positive palm and mandible reflex, and hyperactivity of the mandible reflex. For true bulbar paralysis, there are symptoms such as atrophy of the glossal muscle, loss of the pharyngeal reflex, and failure in lifting the soft palate. According to traditional Chinese medicine, bulbar paralysis belongs to the category of 舌尖、噎膈、口吐涎、阴肺 syndromes. 中风理解病脉症病治 of the 金匮了略 says that as the pathogenic evil invades the internal organs, the tongue cannot function for speech, and there is salivation. Qi Xiao Liang Fan says, when pathogenic evil invades the internal organs, the tongue could not function for speech. There is excessive salivation. Acupuncture is very effective for bulbar paralysis. Prescription. Main points: 治腔、风府、衙门。风池、医风。Points according to the symptoms: 连泉、金津、玉液、海泉。痔腔 is on the upper border of the second cervical vertebra, at the junction between the sternocleidomastoideus and trapezius muscles. 1 point on each side of the neck. Select number 28, 3 to 3.5 cun needles. Thrust the needle from 痔腔 on one side towards 痔肠 on the other side, just under the skin. Apply the even method for 3 to 5 minutes. Do not leave the needle in. Fengfu. Fengfu is located directly below the external occipital protuberance between the occipital bone and the first cervical vertebra. Select number 28, 1.5 cun needle. Puncture 30 degrees obliquely downward, 0.5 to 1 cun in depth. Apply the even needling method and leave the needle in for 30 minutes. Yamen. Yamen is at the midpoint of the nape, in the depression 0.5 cun within the hairline, at the upper edge of the spinal process of the second cervical vertebra. Select number 28, 1.5 twin needle. Insert the needle 30 degrees obliquely, downward to about 0.5 to 1 twin in depth. Apply the even needling method. Leave the needle in for 30 minutes. Puncture. Puncture is on the posterior aspect of the neck, below the occipital bone, in the depression between the upper portion of the sternocleidomastoideus and trapezius muscles. Select number 28, 1.5 twin needle. Insert the needle toward the eyeball of the other side, about 1 twin in depth. Apply the even needling method. Leave the needle in for 30 minutes. Efong is posterior to the lobule of the ear, in the depression between the mandibula and mastoid process. Select number 28, 1.5 twin needle. Insert the needle towards the tip of the nose, 0.5 to 1 twin in depth. Apply the even needling method. Leave the needle in for 30 minutes. Lianquan. Lianquan is above the Adam's apple in the depression at the upper border of the hyoid bone. Select number 28, 1.5 twin needle. Insert the needle toward the root of the tongue, 0.5 to 1 twin in depth. Apply the even needling method. Do not leave the needle in. Haiquan. Haiquan is in the center of the frenulum. Jinjin, Jinjin and Yuye are on the veins on both sides of the frenulum of the tongue. Select number 28, 2.5 twin needle. Puncture 0.2 twin quickly and withdraw the needle immediately. Do not leave the needle in. If there is forced crying and laughing, delirium, restlessness, or dementia, add tongli. Tongli is on the radial side of the tendon of the flexor carpus ulnaris muscle, 1 twin above the transverse crease of the wrist. Select number 28, 0.5 to 1 twin needle, and insert the needle perpendicularly, about 0.3 to 0.5 cun. Apply the even needling method. Leave the needle in for 30 minutes. If the tongue tip is flaccid with excessive salivation, add bilateral 照海 and bilateral 阳陵泉. Zhaohai is located 1 cun below the medial malleolus. Select number 28, 1.5 cun needle. Puncture perpendicularly 0.5 to 1 cun. Yanglin Quan is located in the depression anterior and inferior to the head of the fibula. Select number 28, 2 cun needle. Puncture perpendicularly 1 to 1.5 cun. Apply the even needling method and leave the needle in for 30 minutes. If there is excessive sputum and coughing, add fenglong, 足三里, and shangqiu. Fenglong is located 8 cun superior and anterior to the external malleolus, about 1 finger's breadth posterior to tiaokou. Zusanli is located 3 cun below dubi, 1 finger's breadth from the anterior crests of the tibia. Shangqiu is located in the depression distal and inferior to the medial malleolus, midway between the tuberosity of the navicular bone and the tip of the medial malleolus. Select number 28, 2 cun needle. Puncture perpendicularly 1 to 1.5 cun. Apply the even needling method and leave the needle in for 30 minutes. Typical case. Ms. Zhang, female, 65 years old, was admitted into the hospital due to multiple infarction and bulbar paralysis in September 20th, 1991. While she was taking barium meal as part of the procedure for an X-ray test of her stomach, the liquid went into her trachea by accident. An X-ray showed that both of her lungs were full of barium. The clinical manifestations were hoarseness and difficulty in swallowing. Examination showed hyperactivity of the mandible reflex, positive lip tapping reflex, positive palm and mandible reflex, and positive pathogenic reflex of the lower limbs. A head CT showed bilateral basal infarction. Acupuncture treatment for pseudobulbar paralysis was given to her. Zheqiang, with even needling method, continues